Good afternoon to everyone. I am presenting evaluation of self-administration of topical ocular medication among patients, a hospital-based study. No financial interest. Introduction: an efficacious and guarded regime in the topical administration of ocular medication is requisite in the management of several chronic and acute ocular diseases. The WHO states that irrational use of medication is a global health issue wherein over half of the dispensed prescription drugs are used inappropriately, leading to poor control of the disease. The critical steps to a proper eye drop technique comprise administering a single drop in the pocket, formed by gently pulling down the lower eyelid, having the drop land in the eye on the first attempt, non-touching the applicator tip to the eye, ocular adnexa or face, and eye closure with nasolacrimal occlusion after administration to reduce systemic absorption. Improper eye drop technique may reduce the therapeutic response, enhance the therapeutic response, decreases the systemic side effects, increases unnecessary medication-based, causes traumatic ocular surface injuries, and also add to the economic burden of the disease, which may amplify patient frustration and extend to worsening patient compliance. It is debatable that patient education on appropriate eye drop administration could be one of the simplest and economical ways to achieve both compliance and clinical outcomes. The literature on eye drop administration is inadequate. The aim of the study is to evaluate self-administration of topical ocular medication in patients during follow-up after educating them with proper eye drop installation technique. Objectives: participants' self-efficacy in eye drops installation, patient characteristics, ophthalmologist and patient communication about eye drop administration procedure, and demonstration in a busy clinical setting of a developing country are associated with patients correctly performing the critical steps while installing the eye drops. Materials and methods. Study design is it's an observational study. Duration of the study is 4 months from September to December 22. Sample size is 150. Source of the data is all patients attending VBMC Karnool. Inclusion criteria: age is greater than 20 years, using eye drops greater than 1 month. Exclusion criteria: disability in communication or physical barriers in using eye drops. All patients included in this study, after recording their educational status, were explained about proper eye drop installation technique. That is, washing hands before handling the bottle, shaking the bottle before installing suspensions, not touching dropper tip after opening bottle, tilting head back slightly, pulling the lower eyelid away from eye to form a pocket, avoid touching the ocular surface with the tip of the bottle, holding the dropper tip directly over the eyelid pocket and squeeze the bottle, gently allowing one eye drop to fall in the pocket with non-touch technique and immediately covering the bottle tip with cap. Gentle closing of the eye and performing nasolacrimal occlusion with certain medications. They were subsequently assessed regarding the technique of eye drop installation during their follow-up, and they were categorized into groups according to their method of installation. Results: among 150 patients, only 121 patients could complete the study. 29 patients lost the follow-up. The educational status is 17% completed 10th class and 15% completed intermediate, and rest of the patients are illiterates. Among 121 patients, 71 patients, that is 58% of them, followed perfect eye drop installation technique. Remaining 50 patients, that is 41%, unable to follow explained proper technique of installation. Among 58% who performed perfect drop technique, 50 were completed +2 and 19% of them completed 10th class and remaining are illiterate. Among 50 patients, that is 41%, who failed to perform the proper eye drop installation technique, 76% are illiterates and 14% completed 10th class and 10% completed intermediate. These are the tables explained in the results. Discussion: topical medications are one of the main means of treating many ophthalmic diseases, more so in glaucoma and dry eye, where patient has to use lifelong installation. A proper technique installation is necessary for adequate control of these diseases. Improper use of topical medication is a global health issue wherein half of the applied medications spill over, leading to inadequate control of the diseases. We noted in our study that 58% followed the correct technique. Among them, 70% are literate and remaining are illiterate, and 40% not followed the correct technique. Among them, majority are illiterates. In spite of educating them, nearly 40% failed to follow the correct technique of installation, leading to inadequate control of the disease. Even the literates failed to follow the correct technique. This study suggests that all patients must be explained the importance of proper technique of installation for adequate control of their disease. Conclusion conclusion of a study is there is a need for educating the patients after prescription of eye drops regarding proper installation for adequate control of diseases and to avoid contamination as well as the wastage of drops. Periodical checkup of method of installation of topical administrations even after initial education by consultant or supporting staff is necessary for proper effectiveness of medication. These are my references. Thank you.
Thank you. So your observation of what value, practical value has it added to the patient or the staff or the doctor? What do you think? Your observations of what significance is that?
Not only the initial education, then even in the follow-up periods also we have to educate and we have to check whether the patient is using the proper installation of drops will help for the effectiveness of the medication and lead to decrease in wastage of drops and contamination.
All right, thank you.